So I want to introduce to you Dr. Isabel Perez, and Dr. Isabel Perez is from Colombia, and she is biological dentist, and she and I attended the same university, Quantum University, and both got a second doctorate in quantum advanced medicine. And that's how I know Dr. Isabel Perez. And Dr. Perez, I'm going to turn it right over to you so that you can talk to us about your journey from conventional dentistry and what it means to have gone into biological dentistry and why you did that, okay?
Very good. Well, thank you so much, Dr. Terry. So I'm going to be sharing the screen. And if you can tell me if you can see it, that will be great.
Yep, we got it.
Okay, so today we're going to be talking about emotions, meridians, and teeth. So in my perspective, in my mind, your oral health reflects not only your physical body and what's happening to it, but is also connected with your emotions, with your thoughts, and it is connected to conflicts and traumas that you have had in this life, this personal life, or even from ancestry. So there's a lot of information that is connected with your teeth. So the oral cavity is the beginning of your body's well-being. So according to the National CDC, Center for Chronic Disease and Prevention, there's 6 in 10 Americans that live with at least one chronic disease. And they are the leading causes of death and disability in America. What we have found is that there is a direct relationship between oral disease and systemic diseases. So it is important to understand the connection between oral health, heart disease, for example, stroke, diabetes, preterm low birth weight babies. So there's a lot of low weight babies that are born, and a lot of the mothers are having problems with their mouth, are having inflammation in their gums, are having some periodontal disease. There are some conditions like respiratory conditions that can be affected by having a poor oral health. And a lot of the patients, especially when we went through COVID, they were struggling with this because you know how COVID is related and affects that respiratory system. So if on top of that, you have an oral disease, then it could make things worse. So I want to invite you with this presentation to look at your mouth and the oral cavity, not just that physical part of your body, but just think about the connection that it can have with your emotions, then your psychological state, because you're going to see there is a huge connection regarding the oral cavity and then your psycho-emotional state. So I am Isabel Perez. As Dr. Terry said, I'm from Colombia, South America. I moved here 21 years ago. I did my residency in Miami, Florida. I have twin girls. They're soon to be 17 years old. And I have been a dentist for 20 years, a conventional dentist, but there were a lot of things that I was missing when I was treating my patients. There were things that my patients will come with lesions in their mouth, and with the information that I got from school, it was not enough. So I felt that I was failing my patients. I felt that I was not giving them my best. So that made me think, okay, I need to get more information to provide better health for my patients. And then that's when I joined the integrative medicine in Quantum University. And I have done so much research and just look for more tools to help my patients with. And I did emotion code, and I don't know if you're familiar with that, emotion code and body code. So I'm an emotion and body code practitioner. I have done Reiki. I'm a Reiki master. So connecting with the energy, connecting with that association that we have with our emotions, with our psychological state, and the well-being of our body and the wellness of our body. Then on top of that, I did something that is called dental decoding, where every single tooth, every single surface of a tooth is connected to a conflict, is connected to an emotional conflict, an event that was traumatic, and it can be connected to some limiting beliefs that we have. At the beginning, it was like, I don't understand, why is this possible? But every single time that I have a patient and I tell them, well, this tooth is associated with the relationship with your mother, and they just start crying, tears start running down their face. Because it's like, how do you know? Well, this tooth is related with a conflict that you had or somebody in your ancestry had with the mother. And it's just more and more, the more I do research, the more I find that it's really accurate, and is a way to help people realize that there is a conflict, there is a blockage of energy, what we were talking about, that if we go through our body and we go a little bit about the energy and what we are as energy beings and what we can do with that. But before I go there, I just want to explain a little bit, because a lot of people don't know what it is to be and I'm sorry, I just dropped my my cursor, my mouse. So what is a biological dentistry? When we talk about biological dentistry, we are also talking about an integrative or holistic dentist. So we consider that the mouth is not separated from the body. And a lot of the dentists, traditional dentistry, what they do is there is a tooth that has a problem, they go and fix that problem, they go and fix that tooth. But in our case with biological dentistry, we think about the root cause of the problem. We go and look beyond the tooth. There's something causing this problem, and it could be an imbalance in your diet. It could be that the pH of your mouth or the pH of your saliva is too acidic and is contributing to an increased microbiome, to increase microbes in your mouth. The other thing that we do is we use materials that are more biocompatible, that are friendlier with your body, so less toxicity. And then, for example, if we're going to remove a silver filling, an amalgam filling, which we have done research and we know that science is finding that the mercury that is in the silver fillings, it's a neurotoxic. So a lot of patients that are having some systemic problems, they can be having problems associated with these neurotoxics, with these silver fillings. So when we remove an amalgam filling, we have to be really careful, because the vapor of that mercury, you're going to be inhaling that. So it's going to create even worse problems. So we have to be really, really careful when we remove the silver fillings. For example, I had a patient that she was having, every time that she will get treatment, her whole mouth within the next couple of days will get blisters and will get a lot of ulcers. It was really, really painful. And conventional dentists didn't know what was going on. What we did is we did a biocompatibility test, and she responded highly reactive to the majority of dental materials.
Can you tell us a little bit more, Dr. Isabel Perez, what the biocompatibility test is?
Correct. So what we do is they draw blood from the patient, and then that's in the lab. They send that to the lab, and there is a list of hundreds of different materials. So they test this blood sample and see what is the reaction to this specific material. So we get a report of over 100 materials that are used in dentistry, and it will give us a list of which materials are highly reactive to how compatible is this patient. So for example, if the material is a highly reactive material, that means that the patient's biology is going to have a reaction towards it. So what we want to do is we want to use the materials that are least reactive towards so it's going to be friendlier for them, for the patient.
I'm curious if through this biocompatibility test, if you also may have used live microscopic assessments with the blood to see. Have you tried that, the live microscopic assessments at all?
Not really, because it will be a little harder to do it that way, because imagine if there are hundreds of materials and you're going to do it with a microscope, you'll have to use hundreds of the materials to do it. So it's a faster result if
I
you do
see.
the biocompatibility test.
Compatibility test.
Yes. So it is a possibility, and you might get some response, some answers that way. But I believe this test is a lot faster to do it that way. But that's a great question. We do use our microscope for other things, and I'm going to show you a slide that it will be. It's just an amazing way to see what it is that we do in a biological dentistry. Because the majority of people, you go to the dentist and they floss, patients floss their teeth, they brush, they go every 6 months and have their teeth cleaned, but their gums are still inflamed. And then it's like they're all puzzled. What's going on? Why is it still inflamed? Why are my gums bleeding? And the thing is that when we go and look under the microscope, we can see what kind of bacteria they have. And there's some bacteria that are very aggressive, and they can even cause problems with our white blood cells, with our red blood cells. So it is really important to know exactly what's going on. And that's why we say we look for the root cause of the problem, we're not just treating the surface, we're not just treating one tooth. We have to see what's happening. And then, so I had a patient last week, and I'm going to show you this slide. So on this slide, you can see that if you go to the dentist, you might get x-rays like the first and second image. And then you see on an x-ray what is dark gray or black. That means that there is no density, it's very low density. So for example, that area, I don't know if you see my mouse. Can you see my mouse? So that area that is black, that's the sinus. And then the white, this patient has crowns, so that's why they look white in there. So what we see here, it's okay, it's a root canal tooth, and that's why the roots look white inside, so it's dense. But then a traditional x-ray, just the two-dimensional x-ray, is not really going to show the reality of the problem of this patient. This patient was going to have the crown replaced by his dentist, but he felt that there was something wrong with the tooth. I don't know what's happening, but I don't feel that this tooth is doing okay. So he came for a second opinion to our office, and we take a CBCT, which is a 3D image. It's a CT scan where we can see every single area of the tooth. And look at the third image. You see the difference? Look at here on this first two, there is no sign that there is an infection on this patient. And then on the third image, that's with the CBCT, look at this circle, this bubble here on the root of that tooth, on that molar, where the red arrow is. That's a cyst that this patient has. And if you look at that area where the arrow is pointing, it's showing a rupture of the sinus cavity. So the infection is going to the sinus cavity of this patient. If this patient goes and has this crown replaced without knowing that there is a huge infection in his mouth, that it perforated the sinus floor, this patient is going to have a lot of systemic issues and is going to create a worse problem. So he's going to pay for a brand new crown that basically he's just throwing the money in the garbage. And one of the things that biological dentistry can do is it can save you a lot of money, because if you do see the root cause of the problem and you also find that there is an imbalance in your systemic health, then you're going to be saving a lot of money because you're going to find things a lot earlier. So having the right tools and using the right technology has prevented a lot of bigger problems or bigger complications to patients. For example, we use ozone, which is 3 molecules of oxygen. It works as an antibacterial, antiviral, that helps prepare the environment for the body to heal itself, because the body, if we provide the right environment, is going to help, is going to heal itself. So using the ozone, I have prevented a lot of root canals. Patients that come and they have had a filling done, and we injected with some ozone, the body starts changing the energetic system, and it starts changing and getting ready for the healing, and they don't need a root canal. The pain goes away. The same thing, we use the laser. The laser is can stimulate the healing, the immunity, the immune system. And then we use PRF that has all the stem cells. And this is that is so interesting, because if we can help the body with your own stem cells, and on top of that, you're using the X39 patch, it's just going to create the perfect environment for the body to heal. So your recovery is going to be faster, and you're not going to have the complications that you could have if you don't do that.
Yeah, you know, when you said, Dr. Isabel, about providing the right environment and then the body will heal itself, that's exactly what I thought. Our patches do exactly that. They support our own internal environment to heal for itself. So it supports our own being instead of adding something external. So thank you for associating that X39, because it's such a powerful patch.
It is amazing, because that's what we need, is stem cells. And that's what it does. It activates those stem cells, right? So stem cells can transform into any kind of cell. So if we need bone, that those stem cells are going to create bone. If we need to heal the enamel, for example, on a tooth, that's going to be able to happen if everything in that oral cavity is in perfect condition. So we need to do just use the right patches to be able to achieve the results that we want. And then here we are going to see what we do with the patients that come to our office. Then on this image, so on the right side, we have a tooth. There is some inflammation on the gums. The majority of patients have inflammation on their gums. But what happens is that it creates like a pocket where bacteria starts hiding. And then there is a communication. So bacteria can go and enter into the bloodstream, and it can affect the rest of your body. And that's why it's important to know that what happens in the mouth affects the body, and what happens in the body can affect the mouth. When we look at a slide like this, we're going to see the healthy oral bacteria doesn't have a lot of movement. It's very calm, very little bacteria in it. But if there is an infection, if there is an activity, then you're going to see, and I'm going to play it. So you're going to see, let me see, why is it not moving? Okay. Not sure why it's not moving. It was moving for me. Okay, maybe let me just, because this is really, really important to see. I might have to show it in a different way. Bear with me. Okay. Can you see that?
Mm-hmm.
Okay, so now it is moving. So you see all this little squiggly bacteria in there. You see the little squiggly ones,
Yes.
that one there. So those are spirochetes. Spirochetes are really, really aggressive, and actually they have found spirochetes on patients with Alzheimer's disease in their brain. So spirochetes in the brain. And then look at this thing here. You see, that's an amoeba. It's an amoeba in the mouth. And look how it's moving. What they do is they engulf the white cells, your white cells, that are the ones that are helping defend from infection. So they engulf that and destroy them. They destroy the white cells. And research says that when we find an amoeba in the mouth, there is another bacteria that is really, really aggressive that is called the Porphyromonas gingivalis. And these Porphyromonas gingivalis has been found in patients that have a lot of other systemic conditions. The patients that have, for example, heart disease, they have had stroke, Alzheimer's disease. So there is a really, really important relationship between what's happening in your mouth and what's happening with the rest of the body. And that's why it's crucial for us to see what kind of bacteria we have and what is going on in our mouth before we start thinking, okay, I need to brush more. Maybe that's all I need to do. Well, no, we need to know exactly what kind of bacteria it is that you have in your mouth, because everyone is going to have a different approach. So you're not going to be doing the same thing that a patient that doesn't have any bacteria in their mouth, that is like that aggressive, like the spirochetes or the Porphyra monogingivalis or the amoeba. You're going to have to do different things. You have to use different products to attack this aggressive bacteria. Okay, so can you see, are you seeing that slide again?
Mhm.
Perfect. And if you have any questions, just feel free to ask me and interrupt me at any moment.
So I'm thinking, as you are speaking, Dr. Isabel, how
Mhm.
critical it is for us to continue to patch our system, because as we heal our system, we're healing our teeth and our gums, and we're gaining oral health. And we don't think about that. I think we often think of ourselves kind of sort of from the neck down, and we don't consider, or our brain, but we don't often associate our teeth and our gums in all of that. But systemic is systemic. We're healing our gums at the same time. And it's interesting because I thought just a couple of weeks ago how before I started using the patches, it was common to have a little tenderness in the gum back here or something. I honestly have not felt any tenderness in my gum since I've been patching. So it's obviously, healing whatever minor condition may have been there. It's healing that as well. So
Yes,
very
absolutely.
interesting to
And
connect.
you're going to see a little bit more of why that's happening, other than it is helping your immune system. But as energy beings that we are, so we are energy. If we start looking at our body has the systems, has the organs, and has the cells. And if you go deeper and deeper and deeper, you're going to see that we have subatomic particles. And what is inside those subatomic particles other than just energy? So we are energy, a very small percentage of just matter. So we need to consider that as energy beings, we need to have a pathway, a network where that energy is going to flow, right? And that's with the meridians. The meridians are that energy pathway. It's just like the artery carries blood, the meridians carry energy. And then there is an electromagnetic frequency, because everything in our body has a vibration. It's a frequency, it's vibrating. So then what happens is that we radiate, that is like the aura, is also called the biofield or electromagnetic field, and it can extend about 4 or 5 feet. But what if this meridian, this pathway, is blocked or is interrupted, or there is an imbalance in our meridian? So there's 12 principal main meridians that are associated with the different organs in our body. And what you were saying, that with the patch, your gums are not bleeding as much. There is a cascade reaction that is happening that is creating the perfect environment for healing. And let's say you're having issues with your upper left molar, and then you're putting the patch. So there is probably a blockage in that meridian that runs on that area. So it could be that the liver or the kidneys are having some issues, or your digestive system, the small intestine, is having some issues. By releasing that trapped energy that it is in the body with the help of the patches, then you will be able to start changing that flow of the energy, that chi or ki, that life force that we all have. So the Lifewave patches will activate and interact with the body's bioelectrical energy. It will help. If you look in the screen, that image where this person on the left side is showing that electromagnetic frequency, that biofield, and it has a lot of holes. It means that the energy is not flowing smoothly in there, and it's just not allowing it to flow. If we use the patches, then we're going to be able to achieve a more balanced energy flow, and it can look just like the picture on the side, on the right side. It's a lot more covered. There's no holes, no voids in there.
So those are BioWell images, aren't they? BioWell.
Correct.
Are you using the BioWell some with patching at all, or you have not done that?
I have not done that research, but that will be a really interesting one.
Mhm.
And you can do a study of like maybe within a week, and then just do several, like 2 weeks, a month, 2
Yeah,
months. That will
yeah.
be a good study to do.
It really would be, yeah. Even with maybe half a dozen of your patients, it would be interesting
Correct.
to kind of
Yeah.
follow up with that with the bio. Yeah.
That's a great idea. We need to do that. So the other thing that when we look at the energy, we see that our cells, they run at a minus 25 millivolts, but they require about minus 50 millivolts to make new cells. If a cell is below that minus 25 millivolts, it means that the cell is not healthy. So Dr. Jerry Tennant, he wrote a book, The Healing is Voltage. Highly recommend you to read it because it has a lot of information about how our body needs to have the right frequency to heal. And essentially all chronic diseases have a low voltage. And it turns out that the chronic disease only occurs when you lose the ability to make new cells that work. So when your voltage is at minus 50 millivolts, that's when it makes new cells. So if it's below that, it's not able to renew the cells. So the Lifewave patches are used to boost copper peptide, which is what turns those stem cells into it just stimulates the stem cells. And stem cells, as we talked about, they're the ones that can help you create new cells, like new bone, muscle, nerve, and it can help regenerate. So it can help with making those new cells that we need to be able to balance that frequency, to be able to balance that energy. So one of the important things, and that's why our topic today is about emotions, is associated with the connection of our body with the emotions. There is a doctor, Dr. Candace Pert. She is a PhD and American neuroscientist and a pharmacologist. And in 1973, she discovered a molecule that is found on the surface of every single cell. We have 70 trillion cells in our body. Every single cell has receptor sites, meaning it looks, just imagine like the lock and the key. So every receptor site is going to have a specific key that is going to lock into it. And she wrote a book that is another book I highly recommend you having, is The Molecule of Emotions. And it talks about how every emotion is connected to a receptor site. So our emotional state dramatically affects how or if there is going to be a connection of that receptor site with the ligand, with that peptide that is going to join it. So if you look at the picture, it looks like the little receptor sites, the green part of it, and then the blue part is connecting. And what happens is that once that ligand, that neuropeptide, that neurotransmitter, there's different chemicals that is going to go inside the cell, is going to send the chemical information that it requires. And we can send information that is associated with the happy emotions, the emotions that are just making us more excited, or we can send signals that are increasing our anxiety and our depression. So that's when the patches, like A La Vida, is that correct? Is the one that is going to help us with the mood. Then we can use things like that because it's going to help balance all this system. It's going to help us achieve a better mood. And what happens is that there is a connection between the teeth and the different organs, and there is a connection, and this is according with traditional Chinese medicine, there's a connection between the organs and different emotions. So in the 1950s, Dr. Reynold Wold and Dr. Kramer, they did an experiment. So they started drilling on the teeth and they connected with the different acupoints. The acupoints are specific points where the meridian has in it. So those are specific areas that they're recommended, and I'll show you which areas are good for when you have a toothache or if there is any problem, because there are specific areas that you can apply the little patches on, or you can apply pressure, do acupressure, that can help with pain. So then they found that when they drill a specific tooth, there was a change in a specific acupoint. So they found that connection in the meridian from one tooth with that specific meridian. So one tooth can be associated, for example, the wisdom teeth are connected with your heart. So then every single wisdom tooth is associated with that meridian that runs the heart meridian. So when we think about it, and we know that we are energy, that the energy flows in our body through our meridians, and that every single meridian is linked to an organ, and that every organ is associated with an emotion, you're going to understand now that a specific tooth can carry information of a specific event that happened in your life, a specific emotion, a specific conflict. And then
so what happens if dentists routinely are removing our wisdom teeth? How does that affect our heart?
So there's different things that can happen. Even if you have a tooth removed, energetically, that information of that tooth is still there, right? But when the tooth is removed, it could be that there was a conflict. And this heart, when we talk about the heart, it doesn't necessarily have to be associated with our physical heart. It could be the emotional heart. And traditional Chinese medicine connects a lot with emotions. So that emotional heart. So it could be that this person had some emotional conflict that needed to be solved, even if it was due to a toothache, or there is nothing that happens by chance or by mistake. I believe that everything happens for a reason. And having a wisdom tooth removed, during that time, there is something that needs to happen, right?
And it's true, the morphogenetic blueprint is still there, isn't it?
Correct. Yes, correct. So even if you have a specific tooth removed, the information, that blueprint is still there. So the information is still available, even though the physical part is not there, but the information is still there. So here I have the different areas where you can apply the patches to be able to help with the pain. So we have on the picture the ST5. So what I want you to do is just bite down, put your finger in your cheek, kind of around the area of that ST5. And I want you to clench, squeeze your teeth together. And you can see like the muscle is going to make a little bump. So you're going to find the border of that muscle. That's the masseter. That's a strong muscle. And that point where you feel that that muscle is kind of jumps, that's the ST5. So this is a really good area for pain or swelling of the cheeks or the jaw. A lot of patients that are having jaw issues, TMJ, then this will be a really good point in there. Or when they have like patients that their jaw locks so they cannot open or close, this is a really good point in there. Or some patients that they have like their eyes are like twitching or they cannot close it. So that will be a really good point. If we're looking at the ST2, so you just follow that. If you're contracting your muscle, follow that and go a little bit higher where it ends. You can feel where that muscle ends. So that will be ST6. And that will be also for toothaches. That will be a point when you're like clenching. That's the pain when the patients are really heavy clenchers, when they have bruxism. If I touch that area, they feel really, really a lot of pain. It hurts a lot. And it's usually bilateral, so on both sides. Usually patients that clench their teeth, they might have pain on both sides, sometimes only one side. And then if we are thinking about like swollen gums, it could be on that ST18. So that's when you contract, that's the higher part on kind of under the cheekbone. So that's another area. So those are three really key areas. But if you're having pain and you don't know, okay, I don't know which one it is, I forgot which one is the area that she said, just put it where it hurts. And then something that Dr. Terry recommended is just to stack the ice wave, the tan and the white patch, like one on top of the other. And that helps really, really good with the pain. And for example, you are somewhere out where you don't have your patches with you. And by any chance, somebody has maybe some oil, some essential oils. And then clove oil, you can put it intraorally, or you can apply it in massage. Remember, those are acupuncture points that even applying pressure, putting some acupressure in there, that's going to help relieve the pain. And even like right now, if you have been clenching, if there is more stress, you apply pressure, if you feel pain in one of those areas, that means that that muscle has been working a lot harder than it's supposed to. So there's high chances that you are clenching your teeth. And something that I want to show you that is really interesting, and if you want, you can have a picture of that, because I feel that this is really helpful and it can help a lot of people, because each single tooth is connected, as I said, with a specific organ or a specific part of our body. So I get a lot of patients that they're having, for example, some stomach problems. And the majority of those patients, they have issues with the molars. So if we look on this diagram, you can see that these molars, these two molars on the upper right. So if you have any restorations on those upper molars, upper right or upper left, the second and first and second molars, those are related with the stomach meridian. So a lot of patients that have issues with these teeth, they are experiencing bloating, or they have some digestive problems. Or if there is problem with like breast cancer, for example, you can see if the patient has issues with this specific teeth. So premolar, first and second molars, those are like, and then depending on the side, so it's either left breast or right breast. For example, the lower anterior teeth, those are associated with the kidney and the bladder. So kidney infections or bladder infections, those are associated with that. And there is a lot of problems with bone loss, especially in that area. Majority of patients, they start having some bone loss associated with those lower anterior teeth. So we can see that each group of teeth has different specific organs that are like coupled. So the upper and the lower, they have the similar organs attached, connected to it. So for example, this upper canine is associated with the liver and gallbladder, and the same thing with the lower. But then there is an area, and then when we do look at the meridian system, we know that they run very parallel on our face. But there is one area that they kind of interconnect, they switch, and then you can see that where is on the stomach, the spleen here, and then on the lower is the large intestine. So they switch, like this one switches here, and this one switches here. Same thing on the other side. This is like a mirror image.
I'm wondering, Dr. Isabel, if you have this chart that you can send me separate so I can make it available to our team, because it's difficult. It's very tiny on the screen.
It is.
So if you could send it to me separate sometime through the week, no hurry.
Yes,
if you have it, and then I could just telegram it to everybody.
Perfect, yes. And this is really important, because if you look at it, it's not just associated with a specific organ, but as I mentioned, traditional Chinese medicine correlates, for example, people that are having problems with their liver. The emotion that's connected with the liver is the anger. So if they have experienced a lot of anger in their life, there is going to be an imbalance in their liver. But then look at I don't know if you can see, I know it's a little tiny, but for example, we were talking about the wisdom teeth. So those very last molars, those are the wisdom teeth. So the heart is associated with that tooth, as well as the small intestine, and then circulation and the endocrine system. But if we look at the emotions that are connected with that tooth or with those teeth, there are emotions of loneliness, emotions of acute grief, feeling trapped, or feeling that you're not having joy. There is a lack of joy. There is it's like there's a lot of that I'm not able to do anything. I'm just kind of low like self-esteem, and you're just kind of feeling that you're not going anywhere. What happens when we have these tooth, the wisdom tooth, usually comes when we are around 18 years old. That's a big transition for the majority of people. What happens in there if you're having an imbalance and you're 18 and this tooth is coming out? You experience this kind of isolation. You isolate yourself a little bit. These teenage kids, when they're around that time, they just kind of want to find out what it is that they're going to be doing as an adult. So they want to be in this lonely space. They want to just kind of gather their thoughts. So it is related with your emotions. So if we're talking about those front teeth, for example, those front teeth are connected to fear, shame, guilt, or they're connected with some shyness or deep exhaustion when you're really tired. And the majority of my patients, when they clench, they start having pain on their front teeth. That's because they're exhausted. There is a lot of stress going on. So every single tooth is connected with an emotion, is connected with an organ, and it will be a good way to find out what's happening with your psycho-emotional state. Another patient that I had, she was telling me that her daughter has a tooth, this tooth here missing, the lateral on the upper left. And that tooth with in dental decoding, that tooth is associated with the mother's love, the love for the mother, or the mother function. What's the function of the mother? And it could be the person is experiencing that, or it could be the ancestor had some issues experiencing that. In that case, her daughter had that tooth missing. So like mother function was missing. And biology is very literal. Every organ in our body has like a literal meaning. What's the function of that? So she was missing the mother's function. And the patient started crying when I was telling her that. She said, that's my mom. My mom was never around. I need to forgive her because she was an alcoholic and I'm still suffering and I cannot forget all the things that she did to me, and I've been struggling with that. So our kids, our generations, they carry this information in their DNA. So if there was a conflict in the past and we didn't resolve that, it's going to be represented on the teeth of our kids or grandkids. So it's just really interesting because you can find a lot of information that can help you. If you can bring that conflict that is probably at a subconscious level, bring it to the conscious level, you're going to start changing and doing some transformations. So I do a lot of telehealth, and I can guide people into like what is the best thing for them to do with their oral health. What is the best thing for them to do with their treatment? Having a second opinion. I had a patient, she's in California, and her son was having 2 teeth pulled. And he's only 8 years old. And those teeth were going to be erupting or coming down, the permanent teeth, when he's 12. So it will be about 4 or 5 years before he got a replacement for those teeth. When I looked at the x-rays that she sent me, these teeth didn't need to be pulled. These teeth only needed fillings. So it's really sad and is not okay, but sometimes we need to have second opinions and we need to make sure that what we're doing is the right thing. And then one of the things that I recommend is like, if you're having any treatment done, just do a lot of introspection, because there is something going on at that psychological, emotional, mental, emotional state that needs some work. And then just feel free to email me, send me questions. My email address is, my website is drisabelperez.com, or my email is info@drisabelperez.com. And I'll be happy to help answer any questions you have.
I found your presentation so remarkably interesting, especially in connection to the teeth being connected to emotions. and meridians, because the only connection any of my dentists have ever made in the past has been to the bone structure, and they would always say to me, oh, you have the bone structure of a teenager still at this point. So that's a good thing. But they've never made a connection with emotions in any way, nothing more systemic than just the bone structure. So I found it incredibly interesting and informative.
Thank you. Thank you so much. Unfortunately, not a lot of dentists know about this. And even though there's research about connecting emotions, traditional Chinese medicine is over 2,000 years old. And they have really amazing results with traditional Chinese medicine, but it's not being implemented as much as we should do, because the benefits are immense and there is no side effects. Unfortunately, people nowadays, what they do is they want immediate response. They want to have chemicals like narcotics and things like that that can get rid of the pain. And it's an immediate solution, but it's not the right solution, because you're just covering the surface of the problem. It's like if you have the analogy of the iceberg, you're just covering the tip. There is a lot more underneath. The root cause is what you need to be looking for, because then you're going to be having consequences down the road. Yes, you might be covering that pain right now, and it's really, really good that you can control that pain, but then to do the work, to go deeper, that's what you need to do. You need to find out what's happening. Why am I getting these symptoms? What is this disease? What is this condition for? What am I learning also from this? Because that's an important question that we need to ask ourselves. Why am I, not just the why, but what for? What is this disease for? Or this condition or this situation that I'm going through?
Anybody have any questions for Dr. Isabel?
If I may. Hi, Dr. Isabel. It's Fiona. The reason why I'm not actually got my video on is because I have a swollen face, and it's due to this. So this is very, it couldn't have happened at a better time, you doing this, in truth.
Yeah.
A few weeks ago, I had a severe reaction to a duck egg. And my white blood cells were extremely low, and it's taken a few weeks to get them back. I came off all my patches because I felt I was trying to rush the healing too much. But over the weekend, I've started with the right-hand side top gum, so swollen, so painful. And then today I've woken up with a big puffy cheek. The gum has subsided. It did, that the swelling's gone down, but my face is still swollen. And I've had X39 on. I've used carnosine and glutathione on it, and it has actually brought the swelling down. But it was interesting when you started talking about white blood cells, because I hadn't made that connection that could have possibly been what's going on as well,
Correct. It will be a good idea. Do you know which tooth it is? Is on the upper right?
Probably the third one from the back.
Okay. So yes, it could be a problem that is connected with the gums. And maybe, when was your last dental cleaning?
Oh, it's been a couple of years, in truth. When I lived in the UK, I used to go every 6 months, but since I've moved here, I used to have them done sometimes when I'd go back to the UK, but I haven't had it done in a couple of years. I kind of do it myself, and I use mouthwash. I have these little pokey things I poke between my teeth. I probably brush my teeth about 4 times a day as well, but they are very sensitive. So I use a Sensodyne toothpaste. It's the only thing that calms them down.
So there is different things that we need to look at. We can look at the gum tissue. So there is inflammation, but now you're telling me that even your cheek is swollen. Is that correct?
Correct.
Yeah. Usually, if it's just the gum by itself, it doesn't usually go to the cheek. When it goes to the cheek, it's deeper. The problem is more in the bone. So it could be associated with a combination of the periodontal disease, which is the disease from the gums, or it could be also connected to a lot of bone loss that is creating some bigger problem on the periodontum, bigger problem on that bone, causing that infection or that swelling. So looking at what kind of bacteria it is in that area is really helpful. And if you do have amoebas, then yes, they can be eating your white blood cells. And that's something that we can just look on the microscope. You can see how, like, is there a lot of my white cells in there? And the white cells, we need them because they are our defense mechanism, right? They're defending our body from infections. And if this amoeba is eating it where we need it, so we're going to have complications. But looking at an X-ray, and then if you can get a CT scan, that will be even better because you can see what's happening in there. Do you by any chance have a root canal on that tooth? Is it treated with a root canal?
No, I have a bridge.
I have a feeling that it might be a little more bone loss happening, so more bacteria is going in there, and that's what's causing.
Yeah, because I've never had an issue with it up until now. So then I was just, because I'm thinking, why is this happening now? Because, you know, I've had a lot more issues. I had COVID as well a couple of years ago, and it was quite severe. And I've had a lot of other residual things from that, which I hadn't put it, you know, two and two together. But as time's going on, I'm seeing that, you know, I've been left with a few issues, but the patches have helped an awful lot. But I haven't had an issue with my teeth before, apart from them being sensitive. So, okay, I will, I'll make an appointment with my dentist.
Yes, one of the questions I want to ask you is, how is your emotional state? And you don't have to answer this question. I just want you to think about it. In regards to your dreams, what are the dreams of your soul? And are you accomplishing them?
No. No.
Yes. So this tooth is telling you that you need to be thinking about those dreams because your spirit is wanting you to achieve those dreams.
Yeah.
So our body has different ways to communicate things to us, and our mouth, our teeth are one of them. Every single organ of our body is connected to an emotion, to a desire, and we need to listen to it because we cannot just ignore it. So yes, we need to treat our physical body, which is what you will do going to the dentist. Something I recommend is warm salt waters, but warm salt water, like 8 ounces of water, warm water will be better. Half of a teaspoon of salt, rinse with that 2, 3, 4 times a day. That will minimize the amount of bacteria because bacteria doesn't like the salty, that alkaline environment. Don't put anything hot outside your face because that will increase like the swelling. It can increase the swelling. So don't put anything hot outside your face. If you want to do something, use the patches on that area. Clove oil, you can use, put a little bit of clove oil, just very careful because it can be a little strong.
Now, I remember my mum used to put that on us when we were children. We would chew on little cloves if we ever had a toothache.
Yes.
Also, Dr. Isabel, Fiona mentioned that she brushes her teeth 4 times a day. Is that a good practice? Or I thought that if you brushed so often that you could be removing the necessary plaque on your teeth, and you don't want to do that? Or enamel rather, or the necessary enamel on your teeth, and you don't want to do that?
Not really. The idea is to use a toothbrush that has soft bristles. You don't want to use a medium or a hard toothbrush because that can mechanically remove some of the tooth structure. Brushing 2, 3, 4 times a day is fine, but just use the right toothbrush and then also the right toothpaste, because unfortunately the majority of toothpaste can be a little bit abrasive. They can be really aggressive with the tooth structure, with the enamel, for example. And then there, you can just look online about, just take a look at your toothpaste, look in the chart of the abrasivity, how abrasive this toothpaste is. And you will see some of it, I have really, really high levels of abrasivity. So very
Yeah.
low.
Toothpaste that you recommend? Is there a toothpaste that you recommend? I typically buy SLS and fluoride free, but is there a brand
Yeah.
that you would recommend?
Yes. And then actually, a lot of people think that the toothpaste is something for good breath and maybe to whiten your teeth. And that's a marketing tool. There is no toothpaste, listen, no toothpaste in the market that can whiten your teeth. It can temporarily show some changes, but because they are so abrasive that they're removing some of the stains, but then they're causing a damage on your tooth structure. So just don't go and get a toothpaste that has that says whitening, even though majority of them say whitening now, but just check and see how abrasive it is. We recommend toothpaste that has no fluoride. Fluoride is it's a neurotoxin.
Yeah.
And it can cause bigger problems. And it's not really as beneficial as we think. There's better technology now that we find in toothpaste. And this is like one that I really like is called Boca, B-O-K-A, Boca. It's a fluoride free and it has nanoparticles of hydroxyapatite. Hydroxyapatite are crystals that are in our own enamel, in our own tooth structure. So you are basically feeding your own tooth with the material that it is made of, right? So Boca has fluoride free and nanoparticles of hydroxyapatite. There is another brand that is called Risewell, R-I-S-E-W-E-L-L, Risewell. And that one is really good. It's also fluoride free. And it also helps attack that kind of bacteria that is a little more aggressive. So it's really, really good antibacterial. And there is a mouthwash, Risewell mouthwash. There is a blog that I recommend, and that's our hygienist. The Queen of Dental Hygiene is her website. And there is a lot of products in there that you can find. She has recommended and she has tested and she has done a lot of studies. And it will be a really good information website for you guys to look into.
Thank you.
Yes, you're welcome. But yeah, floss also. Flossing is really, really important.
Religiously.
Good, awesome. Oh, and then Fiona, the other thing is that when you were talking about that you do your own cleaning and you do your own, like you brush really good and floss. I love that. But even though you're doing a really good job at having cleaning your teeth and flossing and all that, it's just like when we are drinking something and our own saliva, it has minerals. So those minerals, they get deposited in between the gum and the tooth, right in the area where we get more inflammation. So by flossing and brushing, we can remove some of that plaque, the majority of it, if we do it right. But those mineral deposits, they get attached in there and they're almost impossible to remove it, or actually impossible to remove it with floss or the toothbrush. You need the tools, maybe the ones that you have, but you need to know how to do it because it can make things worse. Sometimes with those tools, you can even remove tooth structure if it's not a strong tooth structure. So you can make things worse.
So Dr. Isabel, you're getting a tremendous lot of kudos on the chat line. Grateful for having you on. And someone else said they're going to be in touch with you for a virtual consult. And someone's asking, what about using a water pick?
Oh, I love water picks. Water picks are great. Start with this low setting. Don't start with a really high setting. Start very low and go around the gum. Just follow the gum, and that will help a lot. And there's different things that you can do and put in the water pick. Because if you're using it, why not use it something that is going to be beneficial as well, just instead of just water? And that depends on what it is that you need, but something basic and something that we all need, especially now. And I could spend hours talking, but something that you can use is called Biosol, B-I-O-S-A-L. that's another product, and you can order it on Amazon, that can help balance the pH of your mouth. What we want is to have a more neutral pH, around 6.57 is what we want. Unfortunately, nowadays, stress can lower our pH. And then sparkling water, if you are drinking sparkling water, and if you're sipping it throughout the day, you're lowering that pH. Bacteria is going to have a party in there because they enjoy this acidic environment. Juices, sugar, processed foods, all those are going to be lowering that pH. And one of the things that we recommend, and we talk a lot about in biological dentistry, is about nutrition, because you need to feed the right bacteria. And not only the bacteria that is in your mouth, but if your gut bacteria is not doing okay, we're going to see changes in our mouth. We're going to see an increased inflammation on the gums. We're going to see more aggressive bacteria in our mouth. There is a huge correlation between the microbiome in your gut and the microbiome or the bacteria in your mouth. So just neutralizing and making a little environment that is good for this good bacteria and is not as good for the bad bacteria. So biosol is a good idea, or hydrogen peroxide. If you want to use it a little bit on that water pick, you can do that. Our hygienist, she is a little more aggressive with some of the patients that have periodontal disease, and she finds the spirochetes and this amoeba. A few drops of the Clorox, basically. She puts a little bit of drops on those, but that tastes really bad. Something that we also recommend is ozonated oil. So you can get it in the store, you can get it on Amazon, ozonated oil. And if there is inflammation like Fiona, you could do it, but in your case, it's probably a little too late, but it might help a little bit. It's just apply ozonated oil in that area where there is inflammation, and it helps eliminate some of the bad bacteria. It helps stimulate the healing, has a lot of good benefits. Or if there is a sore, like a canker sore, you can apply that ozonated oil. Or even if you want to, for your skin, with aloe vera and essential oil, ozonated oil, that will be a good combination. So water pick, yes, is a good idea. And spraying nano silver solution before sleep. It is good, yes. Maybe check and see how that pH of your saliva. Something I highly recommend is just checking your pH of your saliva. I think a nano silver can be alkaline. That's good. I'm not sure about if you do it every day, if it can start staining a little bit your teeth. But once in a while, it's not a bad idea.
Anybody else have any questions for Dr. Isabel? Okay, well.
Yes, excuse me. I do have a question regarding in your practice, do you use simple antibiotics like penicillin? Because I'm a physician, if a patient comes in to see me, like Fiona, obviously you mentioned also it's very likely there's an infection, and usually penicillin would be helpful for spirochetes and other similar bacteria, in addition to looking for health elsewhere. Do you ever use that?
Correct. So we try to minimize the use of antibiotics, but sometimes it's necessary. In many cases, like Fiona's case, I would like to find out what's the root cause of the problem before giving her just an antibiotic, right? She might need it because of the swelling that she's having and all this, the signs that she's having and the symptoms. But the thing is that hopefully this is not the case, but I do it a lot in patients that need extractions, for example. And then we usually use the PRF. We get their own blood and put the platelet-rich fibrin. And then in that case, we don't want to have a complication. And if it has been an abscess or an infection in that area, we want to make sure that we have the perfect environment for the stem cells to grow new bone in there, for those osteoblasts to have the perfect environment. So in cases like that, we do have to use antibiotics. Yes. But remember, in a case that when there is an infection and we're going to treat it with antibiotics, treating it with just antibiotics, it's just going to be touching the tip of that iceberg. We need to go and do a deeper, dig deeper and see what it is that's causing this inflammation, and then just eliminate the root cause of the problem. But yes, we do use antibiotics in certain cases, but we also use a lot of homeopathic remedies that can help us with some of the inflammation, some of the infection. If the problem is superficial and we can achieve some drainage, we might not even need the antibiotic. But when there is a swelling, extraoral swelling, high chances is that she will need antibiotics.
Thank you. Additionally, I would like to ask you about the connection between emotions and certain teeth. In your experience, have you been able to, it seems to me that you're saying that you can identify or at least raise the issue of emotion when certain teeth or tooth is involved. And that chart seems to associate certain emotion with certain teeth. Has that been the case in your practice? I mean, you see the second tooth to the left, that seems to be connected with certain emotion, and bingo, there's usually cavity there or whatever. What would be the sign or what's wrong with the tooth? Is it usually cavity or is something else that tip you off?
That's a great question. For a problem in the mouth to happen, there is 3 things that need to happen, right? One is for a cavity, for example, to happen, we need 3 things. We need a perfect environment. We need food for the bacteria. So we need bacteria, we need food, but then what has happened in the research that they have done is like people, they have bacteria, they have food, but there is no decay. And a lot of patients have a lot of bacteria in their mouth, a lot of food debris, but they don't have any cavities, right? But then for a cavity to develop, we need to change the polarity of that energy. The teeth are crystals. If we're changing that polarity, it kind of opens up those crystals for bacteria to go inside and create the cavity. So that's one of the things that can happen. And every surface of a tooth has a different meaning associated with an emotion or a conflict. But then if there is inflammation on the gums, there is over 200 different conflicts that are connected with our teeth and our mouth. The bones are connected to certain different conflicts and conditions. And the same thing with the gums, the same thing with pain, and the same thing with the cavities. So there is that's why it's called dental decoding. We have to go and decode what's the information, what's the message that the body or the mouth is trying to communicate to you.
Okay, thank you very much.
Yes, you're welcome.
Dr. Isabel?
Yes.
Yes, ma'am. Thank you so much. A very, very interesting subject. My daughter Anjali just let me know few hours ago. So I have one question, ma'am. Have you heard of oil pulling?
Absolutely, yes. That's a really good tradition in Ayurveda, the medicine from India. And the oil pulling has different functions. If you do it, for example, in the morning, and I don't know, for people that don't know, it's just you put an oil. It could be, I like a coconut oil because coconut oil is antibacterial, so it can help kind of clean and remove some of that bacteria out of your mouth. But if you do it in the morning, at night, our body kind of does some repair, and there is some toxins that come up. If you do it in the morning and you just pull that oil, just switch it around in your mouth for as long as you can handle it, and then spit it. Don't spit it in the sink, spit it in the garbage can because it will block the sink. Then you're going to see how that oil that it is supposed to be clear, it turns really, really white. It's just pulling all these toxins, all this bacteria from your mouth. Don't swallow it because there's a lot of bacteria in there. A lot of people think that they can swallow it, so don't swallow it. That's really helpful. But also some of my patients, and with hormonal changes, especially female hormones start changing, we get a lot of patients with dry mouth or burning mouth. Is like they feel like the mouth is burning or is really, really dry. When you do oil pulling at night before you go to bed, it moisturizes your gums and your tissue. So it helps a little bit with that dry mouth, and it helps a little bit kind of minimize the bacteria in your mouth, preventing inflammation and cavities. So yes, that's a really good idea.
Thank you. So suppose I am 79-year-old and I'm experiencing dry mouth. So do you recommend morning and evening both oil pulling?
Yes, that would be great. But remember that there is a reason why you're having this condition, right? This dry mouth. And so the biological decoding, there is something happening inside of you. And then depending on what kind of body type you have, you're going to be experiencing a lot of heat in your body. So there's different body types, and then you can find out about Ayurveda body type, and you will see if you're Pitta, Vata, Kapha. The majority of the time, if you're Pitta, there's more fire. So if you're eating things that are more spicy, that it will increase the fire. And now we're getting close to summertime, so then you're going to experience more heat, and that can get things worse with the dry mouth because it's drying you up, right? But if there is a hormonal imbalance, you need to find out what it is that is imbalanced. So talking to a naturopath or a functional medicine doctor that can go and analyze what's happening with your hormones, it will be a great idea, because it could be that the estrogen levels are not okay. It could be that your progesterone, your testosterone are not doing okay, and then you're having some dry mouth. Or it could be that there is a blockage. So there's many different things that need to be addressed before just using the oil pulling. Oil pulling will be great, but it is just a temporary solution. You want to go and find out what it is that is causing the dry mouth.
You know, it's an important issue that you bring up about dry mouth. We need to also remember that our body changes, and from year to year, from month to month, actually, our body may not accept what it accepted years before. And I happen to love Indian food. So anytime we travel, we're going to seek out an Indian restaurant. And while the spicing of Indian food has never bothered me before, and when I was in India, and I've been to India 2 times and ate Indian food for 3 continuous weeks, never had an effect on my body. But 2 weeks ago, as we were traveling, we had Indian food for lunch and for dinner. That was on a Friday. Saturday morning, my body was inflamed. My joints hurt. My spine went out of alignment so that I had to go to a chiropractor, which I had not needed to visit for quite some time. And it finally dawned on me, because I thought, oh my gosh, what is happening all of a sudden, you know? Well, it definitely was spicy food that the body is no longer wanting in the way it accepted before. And as soon as I cleaned out my system of the spicy food, that I haven't had that issue again. And yes, you know, as we're going into summer, and summer is Pitta, and we definitely could be potentially eating out more and getting spicy food, that we really have to look at all the environmental issues, because the body is very complex, actually, in many respects, in terms of what's causing what in our system. So
yes. And Renette asked if it was okay to use Himalayan pink salt or what kind of salt. It doesn't really matter, but I like Himalayan pink salt, so you can use that, but it doesn't really matter. It's just the alkaline pH, what we want.
okay, you know, we're going to close. We're so grateful to you, Dr. Isabel Perez. This has been an incredibly informative and very, very, very interesting presentation. And we're grateful to you, and it is going to be recorded. It will take me some time this evening, but tomorrow morning to basically transfer this to the recording. But tomorrow morning, you can find it in the doctor's group share, and I will make sure that it is there tomorrow morning. And I will forward it to you personally, Dr. Isabel Perez. And I thank you all. Now, next week is the 4th of July. I want to wish all of you the most wonderful 4th of July. So we will not have a presentation on Sunday. And again, I love you all. Namaste.
Namaste.
I send you all my love and my light as well. And stay nurtured and stay well. And we'll see each other in a couple of weeks. Bye now.
Beautiful.
Thank you so
Beautiful.
much. Thank you. Bye-bye.
Thank you. I thank you.
I'll be in touch.
Thank you, Dr. Perez.
You're welcome. My pleasure.